Sorry about that. Good morning. My name is Krish Gundu, co-founder and executive director of Texas Jail Project. Thank you for the presentation and the conversation today about continuity of care and recidivism. I really appreciated, especially the conversation around upstream efforts, and it relates to my comment as well. I wanted to share experiences of on our cases of continuity of care post being released from county jails. And my hope is that this council may be able to make appropriate recommendations to the legislature. We've found in our sort of 10 years of doing this work that one of the biggest barriers to continuity of care is actual continuity of care when people are being released from jail. We've learned the hard way from our own cases of taking clients from LMHs, clients of LMHs and LIDAs to their offices upon release from jail, that they have to start from square one in enrolling into services, which takes anywhere from 3 to 4 months to get an appointment with a psychiatrist and to get medication started, which you'll agree is a major public safety issue for many of these individuals who are getting released cold turkey with no meds. So I just want to remind this council that in the audit report that was mandated by Senate Bill 1677 2 sessions ago on the forensic wait list, that it was stated that in a 5-year look back of 15,652 people, at least 168 people had timed out while waiting on the 46B wait list. One would imagine that at least these people would be prioritized for connecting with services prior to release, but in our experience, that has not been the case. And so we saw in that report 341 people being placed on the wait list multiple times on the same charge. We keep seeing cases where people did not have access to the right care at the right time at the right place and end up in jail. In a large majority of those cases, we see families trying really hard over and over again to get their loved ones access to appropriate services before their repeated criminalization. We also have cases in which those individuals ended up dying in county jail custody. I think in the audit report, that number was 54 in a 5-year look back. So my request to this council is to make some meaningful recommendations to the legislature on mandating continuity of care for the state's own clients upon being released from jail. So that process needs to start prior to the release. There has to be a mechanism to connect them back to services if they've been waiting for more than 30 days in jail. So thank you so much for listening. I really appreciate your time in this council's efforts.
Thank you, Krish, so much for your comments to the council. Harkening back to the report that was done in response to Senate Bill 1677, if members of the Statewide Behavioral Health Coordinating Council have not seen the report, we'll be sure to send that out today. It was focused on individuals who have been determined incompetent to stand trial and are awaiting to receive or receiving competency restoration services. And so we'll get that out. But your points about continuity of care and the lack thereof and just opportunities to improve that, your comments are specifically targeting those individuals who are in county jails, but the same is true for children who are arrested and booked and in detention facilities as well. And so we thank you so much for taking the time to be here with us today and to keep these populations of people at the forefront of our minds. Thank you, Krish.